Welcome to this EMT review video on EMS systems. In this brief overview, we'll highlight the key concepts and foundational elements of emergency medical services systems that every EMT should know. This video is designed as a quick refresher and does not include all the details you'll need to master the topic. Be sure to dive deeper into your textbook and class materials for a comprehensive understanding. Let's get started and take a closer look at how EMS systems are structured and how they operate to save lives every day. The text is the primary resource for the EMT course. It discusses what will be expected of you during the course and what other requirements you will have to meet to be licensed or certified as an EMT in most states. Students will learn the differences between first aid training, a Department of Transportation EMR training course, and the training courses for an EMT, Advanced EMT, and Paramedic. EMS is a system, and Chapter 1 discusses the system's key components. The EMS system consists of a team of healthcare professionals, provides pre-hospital emergency care and transport, and is governed by state laws. After you successfully complete this course, you should be eligible to take either the National Registry of EMTs exam or your state's certification exam. After you pass the certification exam, you are eligible to apply for state licensure. Licensure is the process by which states ensure applicant competency in an examination setting. It allows states to manage who can function as a healthcare provider. The EMS system consists of a team of healthcare professionals, provides pre-hospital emergency care and transport, and is governed by state laws. In most states, there are 4 training and licensure levels: EMR, EMT, Advanced EMT, and Paramedic. An EMR has very basic training, provides care before ambulance arrives, may assist in ambulance. Emergency medical responders, such as law enforcement officers, are trained to provide immediate, basic life support until EMTs arrive on the scene. An EMT has training in basic life support including automated external defibrillation, airway adjuncts, and assisting patients with certain medications. An AMT has training in specific aspects of advanced life support including intravenous therapy and administration of a limited number of emergency medications. A paramedic has extensive ALS training, including endotracheal intubation, emergency pharmacology, cardiac monitoring, and other advanced assessment and treatment skills. The origins of EMS trace back to volunteer ambulances in World War I, advanced field care during World War II, and the introduction of field medics and rapid helicopter evacuations in the Korean conflict, laying the foundation for modern emergency medical services. Modern EMS originated in 1966 with the publication of the White Paper, highlighting the need for improved emergency care. The Emergency Medical Services Act of 1973 provided funding to enhance pre-hospital systems, while the DOT developed the first EMT training curriculum in the early 1970s, and the American Academy of Orthopedic Surgeons published the first EMT textbook in 1971. Efforts to standardize EMS education nationally began with the DOT's National Standard Curriculum in the late 1970s. In the 1980s, advanced training expanded EMT roles to include ALS care. The 1990s saw the NHTSA's EMS Agenda for the Future, a plan to standardize education and providers, which was further updated with the EMS Agenda 2050 in 2019. EMS training is structured at 3 levels. Federally, the National EMS Scope of Practice Model outlines minimum skills for each EMS provider level. At the state level, laws regulate EMS provider operations. Locally, the medical director offers daily oversight and support to EMS personnel. The EMS Agenda 2050 envisions a people-centered EMS system built on key components: comprehensive, quality, and convenient care, evidence-based clinical practices, efficient and well-rounded services, a focus on preventive care, and comprehensive, easily accessible patient records. Public access is vital for emergency response. The 911 system serves as the public safety access point, where trained dispatchers gather information and dispatch resources. Emergency medical dispatch systems guide callers with medical instructions until EMS arrives. New mobile apps now alert trained laypeople to nearby cardiac arrests and AED locations, enhancing community response. Human resources. In EMS focus on the people delivering care. The EMS Agenda 2050 emphasizes creating an environment that attracts talented individuals, allowing them to transform their passion into a fulfilling career. Medical direction ensures EMTs are authorized to provide field care, guided by a physician medical director who connects the EMS team with the medical community. Care is outlined in protocols and standing orders, which define the EMT's scope of practice and required actions for specific conditions. EMTs can implement standing orders without prior consultation. Medical control can be offline or online. Offline control includes standing orders, training, and supervision, while online control involves real-time physician directions provided via phone or radio. Integration of health services ensures that pre-hospital care seamlessly transitions to the emergency department, providing patients with comprehensive continuity of care. Evaluation in EMS is overseen by the medical director to ensure quality control. Adopting a just culture fosters a learning environment that balances fairness and accountability, holding team members responsible for their behavioral choices. Continuous quality improvement involves auditing and reviewing the EMS system to identify areas for improvement and provide remedial training when needed. The primary goal is to minimize errors through the Plan-Do-Study Act cycle. EMS system financing varies by organization and can involve paid staff, volunteers, or a combination. EMTs may be responsible for collecting insurance information, securing HIPAA-related signatures, and obtaining patient permission to bill health insurance. In 2020, the Centers for Medicare and Medicaid Services, CMS, launched the Emergency Triage, Treat, and Transport, ET3, pilot program. ET3 aims to reimburse EMS systems for delivering appropriate care at the right time, introducing payment models for transport to alternative destinations like urgent care centers or on-scene treatment without transport. Prevention and public education are key aspects of EMS, focusing on public health and preventing health problems within entire populations. EMS collaborates with public health agencies on primary prevention, such as educating on pool safety and car seat installation, and secondary prevention, like promoting helmet and seatbelt use to minimize the impact of incidents. This table highlights key public health accomplishments, including vaccination programs, clean drinking water, fluoridation of water supplies, helmet and seatbelt laws, tobacco use laws, sewage systems, restaurant inspections, prenatal screenings, and the formation of the Food and Drug Administration. These initiatives demonstrate the vital role of public health in improving community safety and well-being. EMS research plays a critical role in shaping the impact of EMS on communities. By focusing on evidence-based medicine, it ensures that procedures are proven to improve patient outcomes. Many EMS systems rely on the National Model EMS Clinical Guidelines, developed through thorough research and expert consensus, to provide the highest standard of care.